Hello everyone, this is the Theoretical Doctor and welcome back to my channel. If you're new here, welcome. This is a series on the chapter Infectious Disease of Chapter 7 of the STPM Semester 2 Biology series. Check out the full playlist on my channel. If you want access to flashcards on this topic and other videos, do click the link below. It is available on my Pinterest and slides on this topic are available on my website. In this video, we will be continuing on cholera as well as tuberculosis, whereby we will dive into the causes and symptoms, transmission as well as the treatment and prevention for both cholera and tuberculosis. We shall begin with cholera. So, causes and symptoms. It is a waterborne disease. Causative agent Vibrio cholera. It is a coma-shaped motile bacterium with a distinctive flagellum. So it's coma-shaped, it's motile, it's able to move with a distinctive flagellum. This one. It is a notifiable disease. So symptoms, very watery and cloudy looking diarrhea. They refer to as rice water diarrhea. Why rice water? Because if you're Asian, I'm Malaysian. Okay, so anyway, when you want to cook the rice, you will wash the rice first, right? So after you wash the rice, the water that you throw away, that's the rice water actually, and you notice it's like sort of whitish, not completely opaque white, but grayish whitish, that one. So the diarrhea will look like that. It's that color. It's associated with vomiting, abdominal cramps, and dehydration. So how to spot dehydration? There's low blood pressure, sunken eyes, rapid pulse, dry mucous membrane or mouth, dry skin, excessive thirst, and low urine output. There's also electrolyte imbalance, generalized weakness, and once they are infected with the bacteria, the symptoms usually appear within 2 to 3 days. However, only about 1 in 50 infected people develop the disease, and the rest of the people become carriers. The transmission of cholera. So the bacteria enter the body via ingestion of contaminated food or water. It is not passed like in dengue through a vector, and it's not airborne either, so it's through ingestion. And infected people can pass out large number of bacteria in their feces, which may contaminate water supplies, and this is really scary because once they contaminate the water supply and there is no proper filtration, then other people can get infected. So the food may be contaminated by infected food handlers who do not wash their hands adequately after using the toilet, and it's commonly found in food sold by street vendors. Not all street vendors. Sometimes this can even happen in a properly established restaurant, but just saying. So what happens is in the small intestine, these bacteria, they will multiply rapidly and secrete the enzyme neuraminidase and exotoxin cholarogen. Actually, in our stomach, our acid is really strong, and usually when these bacteria go through, they do not survive our stomach acid, but sometimes they do, and the ones they do in the small intestine is where the problem starts. So they multiply and they secrete neuraminidase and also the exotoxin. So this neuraminidase will change some of the surface proteins on the membranes of the epithelial cell in the small intestine. So in the small intestine, they will start having receptors for this toxin. So the neuraminidase comes in and they change it, and the toxin comes in and they start to bind to it. So this toxin, it will stimulate the epithelial cells to secrete large quantities of chloride ions into the lumen of small intestine. So it's causing all these chloride ions to come out. Now, what happens is when these chloride ions come out, these sodium ions and the water follows the movement of chloride ions. So these chloride ions come out from the lumen of small intestine. Sodium ions also follow, water follows, and then it will cause severe diarrhea because now all the water is coming out from the body and it's all collecting in the intestines. So this will result in violent inflammation of the intestine, and the toxin also prevents the normal absorption of salt and water because it's not being absorbed by the body, it's all coming out, it's all following the chloride ions, and this will result in vomiting as well as severe diarrhea. Treatment. Since it is a bacterial infection, then you can give antibiotics. Next would be to give oral rehydration therapy, ORT, or sometimes referred to as ORS, which is oral rehydration solution. This is to replace the electrolyte lost through diarrhea, and it is given orally or intravenously. Prevention: issue travel restriction in and out of affected areas, because remember, the water supply can be contaminated by infected people through their feces. Ensure that people have access to clean drinking water. Proper sewage treatment, sanitation, and drainage, because if the sewage is not treated properly, and after it is being supplied to the houses and all, other people can also get infected. Control of flies, which may transfer fecal matter to exposed food, like usually will chase the fly away, so sometimes you never know where they land, right? Educate the public to maintain high standards of personal hygiene, especially when preparing food. So guys, never dismiss, just make it a habit to wash your hands constantly and wash it properly, of course. Isolation of patients so that their feces or vomit can be disposed hygienically, because these bacteria will be found there, and then if it goes into the water supply, it can contaminate the water supply and other people will get it. So improvements in basic human hygiene, and also vaccination. This vaccine contains heat-killed bacteria. It's a form of passive immunity, meaning that the person won't be immune to cholera infection for a lifetime. It's just for a short period of time. So the protection is only about 40 to 80% and lasts for 3 to 6 months. Moving on, tuberculosis. So it is an airborne disease caused by 2 species of Mycobacterium. Mycobacterium is a fungus-like rod-shaped bacteria. It's usually by M. tuberculosis or M. bovis. M. bovis is found in milk products, but it's rare. It is a notifiable disease. So symptoms: weight loss, fever, persistent cough lasting for 2 weeks or more, never ending, blood-stained sputum. Sputum is phlegm, so sometimes they may say, oh, I cough out blood, but actually it's not blood. It's just, if you were to look at it properly, of course, it's just phlegm with some blood. Excessive sweating at night, shortness of breath or wheezing, chest pain, clubbing of fingers. Clubbing of fingers, basically the end of the digits, the end of the fingers are just swollen, so they have like a drumstick appearance. Alright, so how it's being transmitted. For tuberculosis, there's primary TB or tuberculosis infection, as well as post-primary infection. Post meaning after. So here I will talk about the primary infection first. So tuberculosis can affect many organs, but pulmonary TB, pulmonary meaning the lungs, spread by droplet infection, and that's the most common. So what happens is, after a person breathes in the droplets from an infected person, the bacteria is taken up by the alveolar macrophages, which cannot digest the pathogen. They can't digest it, they can't kill it. So these bacteria, they're still alive, they're just inside the macrophages. So these bacteria multiply within the macrophages, forming small nodular growths or tubercles in the lung tissue, causing tissue death, and they will form cavities in the lungs. So from here, the bacteria can spread to other organs in the body, and this is called primary tuberculosis infection. So the body's immune response to TB infection is to produce a hormone-like chemical, and this will cause fever in the person, and it will suppress the appetite of the person. So that's why they come in with weight loss, and it's not just small amount of weight loss, like it's actually quite severe. So that's why the patients are usually extremely thin over here, or scrawny, or they have lost a lot of weight, and on top of that they have blood-stained phlegm. Here is the post-primary infection. So post meaning after the primary infection. Sometimes we may be infected, but the bacteria is inactive in our body, so we do not present with the symptoms or signs. So it will lay dormant for many years, and it only shows up when there is such immunosuppressive conditions like HIV, or maybe malnutrition, or maybe after an organ transplant like that, or cancer. TB is mostly transmitted by droplet infection, as mentioned before. However, it requires prolonged contact with an infected person. Prolonged contact, this usually happens for healthcare workers who are working or in the wards where there are a lot of TB patients, that doesn't mean that they will contract TB. Most of the time they're okay. So sometimes they may be infected, but they do not present with the signs and symptoms. So the transmission of pulmonary TB is by breathing in air droplets from cough or sneeze of an infected person. Not everybody. People with inactive form of the bacteria cannot spread it to others. However, the bacteria becomes active. It can become active when the carriers are weakened by other conditions, as I mentioned before, HIV, cancer, malnutrition, like that. So this is the post-primary infection. Tuberculosis in general is prevalent in refugee or prisoner of war camps, shelters for homeless people, or in overcrowded, congested living conditions in slums and inner cities. Basically, if there's overcrowding, there tends to be a lot of TB cases. Treatment of tuberculosis, antibiotics, because after all, it is a bacterial infection. So the symptoms will improve in 2 to 3 weeks, definitely. However, the patients must continue the antibiotic regime for 6 months, because once a person has TB, they will give a set of medications for 6 months, and that's a really long time to take. They will cure in 2 to 3 weeks, and they have to take antibiotics for 6 months, but no, they have to complete it, because stopping before that will cause the bacteria to become resistant, and infected patients are to be quarantined at home or in hospitals, depends, until they are no longer contagious. So prevention: infected individuals need to stay at home or admitted in the hospital. This is to avoid spreading the disease to others until they are no longer contagious. And the DOTS campaign. So the DOTS campaign is direct observed treatment under supervision. Basically, the nurse or the healthcare workers, they will give the medication to the patient, and in front of the patient has to consume the medication. So they'll basically wait until they have seen that the patient has taken it. So this is actually an effective way because they're on it for such a long time. Prevention in terms of biological factors would be through the BCG vaccination, so Bacille Calmette-Guerin, and this BCG injection is usually given at birth. If you notice your left arm, there's a BCG vaccine scar. So at least for most of us, it's on the left side. Sometimes for some people, it's on the right side. So around 12 years of age, if the BCG scar is not present, well, at least in the Malaysian public school setting, it will be given again. If you've reached this point, thank you very much. Hit the like button if you found it helpful, as it does help in reaching out to others as well. Do support my channel by pressing the subscribe button so I will know, and it gives me motivation to continue producing content like this in the future. And finally, share this video to those who might find this helpful. I'll see you in the next one.